In fact, now listen to this. This is something to cheer about. The California hospitals that saw the greatest reduction in mortality after the ratios took effect were the ones that started with the worst staffing ratios. So the biggest improvements were made in those hospitals that didn't respect nurses, didn't understand what nurses bring to the table, didn't understand what real patient care means. So thanks to the California law, more registered nurses are entering the workforce, mitigating the nursing shortage. So what we are proposing to do nationally has been proven to be correct in California. Once more, California leading the nation. We love it. Now, we need your help as we embark on this healthcare reform effort. At 2.9 million strong, nurses are the largest healthcare workforce in our country. I'm going to say it again. You are the largest healthcare workforce in our country. Your voices are authoritarian voices when it comes to this. You speak with authority. You know what is going on. And with your help, I know we can make progress and bring about a positive change for nurses and patients. Now, as I look around this room and I see these faces, yes, women and men. I think the women should applaud the men for coming into this field. Yeah. Oh, a lot of kisses going on here. I think I struck a chord. Go ahead, have a party. Okay, enough of this. You know, it's really interesting. Yesterday, I went on the Ed Schultz show. You should watch Ed Schultz. He's very good. And it was about Olympia Snow and I have joined forces, Republican woman, she, Democratic woman, me, and we are calling on President Obama to appoint a woman to the bench. And and so, you know, Ed Schultz is saying, you know, tell me why it's important. And I said, well, it's obvious. Women make up 51% of the nation. There's 9 Supreme Court justices and 1 woman. So now I'm looking in this room and I'm seeing another look. And I said to him, suppose there were 8 women and 1 man on the Supreme Court. I said, wouldn't you say we need to have more balance on the court? And by the way, that's an issue that's very important to nurses because a lot of these cases involve health care, as you know, that work their way up. And as we also know, health care, a health crisis in a family is now the leading cause of bankruptcy in our families. So this issue, you are in the middle of the hottest issue in the country. And it gives me great comfort to know that you will be part of this healthcare debate because you are the face of healthcare, really, to most Americans. You know, we see our doctors for 5 minutes and we see our nurses for hours when we're in greatest need. You know that. Well, I want to close with this, and it's touching and moving to me because we've all had family members that could never have made it without caring nurses, and in their last days could never have gone peacefully without caring nurses. So what I'm going to say now is very touching to me. For every wound you have helped to heal, and for every patient you have ever watched over, for every life you have saved, and every family that you have comforted, you have my thanks and my support. And this bill that I introduced today is for you and for the patients you so faithfully serve. Thank you so much. I'm with you all the way. Thank you very much. Thank you.
Some woman, huh? You know, all of you in all of your states now have to go organize your barber boxers. No, I'm serious, because that Senate, you know, she'll stand for us, but she can't stand alone.